EMT NICE Practice Exam Emergency Medical Technician Study Guide 25 Key Questions. Question 1. What is the primary role of the EMS provider regarding diagnosis? Provide a definitive diagnosis. Provide a differential diagnosis. Provide a field impression and initial treatment. Consult with the family for a diagnosis. EMTs provide a field impression based on assessment and symptoms, not a definitive medical diagnosis. Question 2. In what position should an unconscious overdose patient without spinal injury be transported? Supine, prone, lateral recumbent, side-lying, Trendelenburg. The lateral recumbent, recovery, position helps prevent aspiration if the patient vomits. Question 3. The Pre-Hospital Care Report, PCR, is legally considered public record, part of the patient's hospital chart, a personal memo for the EMT, inadmissible in court. The PCR is a legal medical document that becomes part of the patient's permanent medical record. Question 4. Approximately how many liters of blood does an adult male weighing 150 pounds have? 3 liters, 4 liters, 6 liters, 10 liters. An average adult has approximately 5 to 6 liters of blood. Question 5. Which piece of equipment is designed for removing patients from heights or carrying them over rough terrain? Stair chair, Stokes basket, D-ring stretcher, wheeled stretcher. The Stokes basket stretcher is used for technical rescues and rough terrain. Question 6. The alveoli of the lungs are in close contact with which structures to facilitate gas exchange? Bronchioles, pulmonary arteries, pulmonary capillaries, diaphragm. Gas exchange occurs across the alveolar capillary membrane. Question 7. Which NICE law establishes the level of care and scope of practice for EMS providers? Good Samaritan Law, General Municipal Law, Public Health Law, Penal Law. Article 30 of the NICE Public Health Law governs EMS. Question 8. The anatomical structure that carries air from the throat to the lungs is the esophagus, pharynx, trachea, larynx. The trachea, windpipe, is the main airway leading to the bronchi and lungs. Question 9. If a conscious, competent adult refuses treatment, the EMT should treat them anyway under implied consent, call the police to force treatment, explain the risks of refusal and document the refusal, leave the scene immediately. Competent adults have the right to refuse care. The EMT must ensure they understand the risks and sign a refusal form. Question 10. You find an 80-year-old female in cardiac arrest. The family presents a valid NICE non-hospital DNR form. You should perform CPR anyway. Contact medical control for permission to stop. Respect the DNR and provide comfort care only. Wait for the police to verify the document. A valid NICE non-hospital DNR must be honored by EMS providers. Question 11. What is the normal respiratory rate for an adult at rest? 8 to 12 breaths per minute, 12 to 20 breaths per minute, 20 to 30 breaths per minute, 30 to 40 breaths per minute. The normal range for an adult is typically 12 to 20 breaths per minute. Question 12. The golden hour in trauma refers to the hour before the accident occurs, the time from injury to definitive surgical care, the first hour after arriving at the hospital, the time it takes to extricate a patient. The golden hour is the critical window where survival rates are highest if the patient reaches definitive care. Question 13. Which of the following is a sign of inadequate breathing? Equal chest rise, pink, warm skin, cyanosis and use of accessory muscles, air movement from the nose. Cyanosis, bluish skin, and accessory muscle use are clear signs of respiratory distress/failure. Question 14. The compression to ventilation ratio for 2 rescuer CPR on an infant is 30:2, 15:2, 3:1, 5:1. For 2 rescuer infant/child CPR, the ratio is 15:2, 30:2 for single rescuer. Question 15. When assessing a patient's blood pressure by palpation, you are only able to obtain the systolic pressure, diastolic pressure, mean arterial pressure, pulse pressure. Palpation only allows the provider to feel the return of the pulse, which is the systolic pressure. Question 16. A stridor sound heard upon inspiration usually indicates fluid in the lungs, lower airway obstruction, upper airway obstruction, asthma attack. Stridor is a high-pitched sound caused by narrowing or obstruction in the upper airway, larynx or trachea. Question 17. What is the first step in the primary assessment of a patient? Check the pulse, assess the airway, form a general impression, administer oxygen. The primary assessment begins with forming a general impression of the patient's condition. Question 18. Which pulse site is used to assess an unresponsive infant? Radial, carotid, brachial, femoral. The brachial pulse is the preferred site for infants because the carotid can be difficult to locate in their short necks. Question 19. Shock caused by severe allergic reaction is known as hypovolemic shock, neurogenic shock, anaphylactic shock, septic shock. Anaphylaxis is a life-threatening systemic allergic reaction. Question 20. The process by which oxygen moves from the blood into the body cells is called ventilation, respiration, perfusion, oxygenation. Perfusion is the delivery of oxygen and nutrients to the cells via the circulatory system.